question here. The nurse working on a inpatient psychiatric unit and is preparing to administer 9 a.m. medication to the client. So the medication administration record shown in exhibit. So usually the question when come like this, you have to get a button. If you click, you can see the list of drugs what your patient taking right now. So like if you click the button, you can see patient taking acetaminophen, haloperidol, right? So they said if the patient take haloperidol as an antipsychotic, on assessment, the client, you found the patient is tremulous, means tremor, also muscle rigidity, body temperature more than normal, 101 degree Fahrenheit, right? So which action should the nurse take first? So the patient who are taking antipsychotic like haloperidol, when you assessment your patient, you can found some of the signs, symptom like body temperature increase or muscle rigidity and also tremulous. Usually the antipsychotic, they have a ability to produce neuroleptic. So we call neuroleptic syndrome or malignant neuroleptic malignant syndrome. So if the patient develop this type of syndrome as a RN or LPN, what we could do first? There are 4 options. Give all medication, include acetaminophen, and reassess 30 minutes. Hold the haloperidol. Haloperidol is a typical antipsychotic. And give the acetaminophen and assess the 30 minutes. Number 3, hold haloperidol, notify the healthcare provider immediately, and hold the hydrochlorothiazide and notify healthcare provider. So as a healthcare provider, every student must know what is neuroleptic malignant syndrome because of atypical antipsychotic. It is the medical emergency. So we must hold the medication like haloperidol. Then we notify healthcare provider rather than to wait for 30 minutes. So now here we are going to focus what is neuroleptic malignant syndrome. Before to go neuroleptic malignant syndrome, every student must know what are the different antipsychotic medication. The antipsychotic medication classified into 2 categories, typical antipsychotic and atypical antipsychotic. The name we use as a typical antipsychotic, most common one, we use the phenothiazine. Phenothiazine consists of florfenazine or chlorpromazine. So phenothiazine more commonly used in hospital, in psychiatry, mental health. Other common phenothiazine are thorazine or promethazine. Phenothiazine we use orally intravenous or intramuscular. Usually intramuscular one lasts longer. So these phenothiazine are typical antipsychotic. Other typical antipsychotic are haloperidol or droperidol. And last one here, it is chlorprotaxine. Okay, so all typical psychotic drugs work best on positive psychotic syndrome. So the patient who have positive psychotic syndrome, the typical antipsychotic work better. So other most common typical antipsychotic we use, most common I said, haloperidol, or we use the chlorpromazine, or it is called thorazine. Typical antipsychotic are also called first generation or neuroleptics. They are able to produce the neuroleptic syndrome, so it is called neuroleptics. So what does neurolepsis means? It means it is the altered the motor function. It is decrease the level of consciousness. So in this patient develop some of the sign and symptom like increase the body temperature, and also this patient develop here in the question they said muscle rigidity and tremulous, right? In this picture we can see what are the other effect of neuroleptic malignant syndrome, like diaphoresis, excessive sweating, tachypnea, blood pressure go up, hypertension, tachycardia, and dysarrhythmia. Also muscle rigidity, fever, alter the mental status, level of consciousness decrease. So some patient, so as a LPN or RN, if your patient take the antipsychotic, we has to monitor the side effect of medication. Especially monitor the side effect of tardive dyskinesia. This is another major side effect. Means patient the irregular movement of tongue. So the tongue is protrude outside. Okay. Now here atypical antipsychotic also, what they are, like clonazepam, risperidol, or olazapine. So atypical antipsychotic are called second generation antipsychotic. Most common are olazapine, clozapine, risperidol, aripiprazole. So there's some advantage of atypical antipsychotic over typical antipsychotic. Atypical antipsychotic has or have less extrapyramidal syndrome, like less chance to develop the neuroleptic malignant syndrome, less chance to develop the dyskinesia. But atypical antipsychotic also some of disadvantage, because atypical antipsychotic sometimes can cause metabolic change. Metabolic change, like patient develop diabetics mellitus, weight gain, and dyslipidemia. So let me read it. Atypical antipsychotic has a disadvantage. They develop metabolic changes, like patient develop metabolic diabetic mellitus, weight gain, and dyslipidemia. So cholesterol go too high. So if your patient take risperidone or clozapine or olazaprine or aripiprazole, we could monitor blood sugar level, we could monitor body weight, and also cholesterol. The major side effect of atypical antipsychotic medication, they have a chance to develop agranulocytosis, means WBC go down. When WBC go down, or if they have agranulocytosis, they will complain of fever, body ache, sore throat. Basically, sign of infection is more common. And let me read the explanation about this question. The client is exhibiting the sign and symptom of neuroleptic malignant syndrome. So the neuroleptic malignant syndrome, very uncommon but potentially life-threatening reaction. This is the reason when we see the patient has sign and symptom of neuroleptic, we did not observe, we notify immediately to the healthcare provider. And neuroleptic malignant syndrome is most often seen with typical antipsychotic like haloperidol or phenothiazine or fluphenazine or thorazine. However, even new drugs, atypical antipsychotics, especially clozapine, risperidone, or olazaprine, can cause neuroleptic syndrome. And neuroleptic syndrome is characterized by fever, muscle rigidity, altered mental status, and also autonomic dysfunction like sweating, hypertension, and tachycardia. Basically, extremely high the vital sign like high blood pressure or high body temperature. Patients sometimes develop seizure or catatonic behavior. If our patient we see the sign symptom like this, most priority control the body temperature. So next, the most important intervention, immediately discontinue the antipsychotic medication and notify healthcare provider for further management. What are the education objectives? NMS is characterized by fever, muscle rigidity, altered mental status, and autonomic dysfunction. The most important intervention, discontinue antipsychotic, notify healthcare provider, and priority to control body temperature. The question here, the home health nurse reviewing the serum laboratory test resulting for the client with a seizure. The phenytoin level is 27 microgram per dl. The client makes which statement that may indicate the presence of dose-related drug toxicity and prompt the nurse to notify healthcare provider. So our patient diagnosed they have a seizure, and patient took the anticonvulsant medication phenytoin. After monitoring the blood level of phenytoin, we found it is 27, right? Little bit higher than the normal therapeutic range. The client makes which statement that may indicate the presence of dose-related therapeutic toxicity. And we need to notify healthcare provider. Number one, I am feeling unsteady when I walk. Here we are going to see what are the sign and symptom of phenytoin toxicity. And feeling unsteady when I walk is one of the signs of phenytoin toxicity. I'm getting up to toilet urination about 4 times during the last night. It is normal sign. I have a metallic taste in my mouth when I eat. So it is also the normal sign who take the phenytoin. My gum are getting so puffy or red. It is also the known side effect of phenytoin toxicity. We can tell our patient about it. So anticonvulsant, we are talking about here phenytoin we use for the seizure. What are the other anticonvulsant commonly we use in psychiatry, like phenobarbital, valproic acid, and gabapentin? So about the phenytoin, what are the nursing NCLEX tips we could know? Basically, phenytoin better do not give with food or do not take with oral birth control pill. Very important. So also it is important if we give phenytoin IV, we only give with sodium chloride. What are the other important note here we could know? Let me read the phenytoin. Other name of phenytoin is called dilantin. So phenytoin is an anticonvulsant drug used to treat generalized tonic-clonic seizure. The therapeutic serum phenytoin range are 10 to 20 microgram per dl. In this question, our patient is 27. It is more than normal. The level are measured when therapy is initiated and periodically throughout the treatment to guide dosing until a steady state is attained. And if the seizure actively increase. So the common known side effect of phenytoin are Common side effect of dilantin or phenytoin, they can cause gingival hyperplasia or hypoglycemia, means blood sugar go down, or dizziness, nervousness. Sometimes they can cause mild skin rash or itching. So here if our patient take anticonvulsant like phenytoin, it can become toxic in the body, and it can cause the dependency. Also, the phenytoin can cause drowsiness, and also keep in mind phenytoin or dilantin should not be taken with antacid, because antacid will decrease the absorption of phenytoin. And phenytoin may change the urine to a light rust color or discolor of urine. Also, will still allow the patient to have a seizure despite being on medication, and watch for them. And if your patient take anticonvulsant like phenytoin, do not give any other medication with the anticonvulsant, especially over the counter. So now question, what are the signs of phenytoin toxicity? The early sign of toxicity include nystagmus or gait unsteadiness. So nystagmus means twitching the eye movement, or unsteadiness means loss of balance, feeling of light headache, slow and shallow breathing, muscle stiffness, tremor, nausea, and vomiting. And bradyarrhythmia and hypertension are usually seen with intravenous phenytoin. What are the education objectives? So phenytoin or anticonvulsant drugs used to treat generalized tonic-clonic seizure and common symptom of phenytoin drug-induced toxicity involve the central nervous system like ataxia, nystagmus, difficult to speech, or decrease the alertness or level of consciousness change. But gingival hyperplasia is a common expected side effect of phenytoin. It does not the drug toxicity, right? So here